Hi everyone, my name is Julianna, and today Daniela and I will be talking about ADHD, or Attention Deficit Hyperactivity Disorder. Before we begin, we will just do a land acknowledgement, and this is for Toronto, where the Dish with One Spoon territory is located, as well as X University. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. Our agenda for today will include the following: an introduction, what is ADHD, some statistics, risk factors, what are the warning signs, and adult ADHD. Then I'll pass it over to Daniela, who will go over treatment, misconceptions about ADHD, coping with ADHD, supporting someone living with ADHD, supporting a client, resources, and important points to remember. To begin, Attention Deficit Hyperactivity Disorder, or ADHD, is a type of neurodivergent disorder that affects many people. To be neurodivergent means that one has certain variations within the brain, but these people also have certain strengths. Neurodiversity is a relatively new term that is used to describe conditions such as ADHD, autism, and learning disorders such as dyslexia. The hope with creating this word was to shift the focus of discourse about ways of thinking and learning away from the usual language such as being deficit, having a disorder, or impairment. ADHD is one of the most common mental disorders affecting children, but it can also affect many adults. Individuals with ADHD have differences in their brain development and activity that commonly affects attention, the ability to sit still, and having self-control. ADHD is most commonly diagnosed in males rather than females. This disorder is usually spotted during the early school years when children begin having problems paying attention. There is no prevention or cure for ADHD, but spotting it early in addition to good treatment and education plans can help any individual manage their symptoms properly. About 6.1 million children in the United States, or 9.4%, between ages 2 to 17 are estimated to have ever been diagnosed with ADHD. In this same study, they found that boys are more likely to have ever been diagnosed with ADHD than girls, at 12.9% rather than 5.6%. The worldwide prevalence of adult ADHD is estimated to be 2.8%. 75% of children with ADHD undergo some type of ADHD treatment. 31.7% receive medication and behavioral treatment. 30.3% take medication only, and 14.9% undergo behavioral treatment only. In addition, 2/3 of children with ADHD also have at least one other condition. 51.5% have behavioral or conduct problems, 32.7% have anxiety, 16.8% have depression, 13.7% have been diagnosed with autism spectrum disorder or ASD, 1.2% have Tourette syndrome, and 45% have a learning disorder. There is no 100% certainty on what may cause ADHD, but experts have some ideas. For genes, this includes that ADHD tends to run in families. For chemical imbalance, it is thought that certain brain chemicals may be imbalanced in individuals with ADHD. For brain changes or changes in the area of the brain that control attention are often less active in children with ADHD. As well, there can also be altered development during pregnancy, meaning that a mother who has poor nutrition, infections, smokes, drinks, or experiences substance abuse during pregnancy, this may affect a baby's brain development, causing ADHD. As well, toxins such as lead can affect a baby's brain development, or brain injuries or disorders or damages to the frontal lobe in the brain can also cause problems controlling impulses and emotions, which may also be thought to cause ADHD. Symptoms of ADHD differ with age. We will now discuss symptoms in children, and adults will be on the next slide. Symptoms are grouped into 3 types in children: inattentive, hyperactive impulse, and combined. Inattentive includes the following: is easily distracted, doesn't follow directions or finish tasks, doesn't seem to be listening, doesn't pay attention and makes careless mistakes, forgets about daily activities, has problems organizing daily tasks, doesn't like to do things that require sitting still, often loses things and tends to daydream. Hyperactive impulse, on the other hand, includes the following: often squirms, fidgets, or bounces when sitting, doesn't stay seated, has trouble playing quietly, is always moving such as running or climbing on things, talks excessively, is always on the go or as if driven by a motor, has trouble waiting for their turn, blurts out answers and interrupts others. And finally, combined, which involves signs of both other types. Some individuals go into adulthood without ever knowing they have ADHD. Every adult with ADHD has had it since they were a child. Diagnosis in adult ADHD is much less common, but it is not impossible. Around 4 to 5% of U.S. adults have ADHD, but very few get diagnosed or treated. The symptoms of ADHD in individuals changes as a person gets older. Symptoms of adult ADHD include being late or forgetful, anxiety, low self-esteem, problems at work, trouble controlling anger, impulsiveness, substance abuse, being disorganized, procrastination, being easily frustrated, they're often bored, have difficulty concentrating, especially when reading, having mood swings, depression, or relationship problems.
Now we'll discuss treatment. There are a few treatment options for ADHD, including medications, behavior therapy, and mental health counseling. Psychostimulants are the most commonly prescribed medication for ADHD. They work by increasing and balancing levels of brain chemicals that improve symptoms. These include amphetamines or methylphenidates. They can be found in either short or long-acting forms. As the correct dose varies per person, it may take time to find the right medication to use, and doses may have to change, either with time or if the current dose has too many side effects. Behavior therapy, social skills training, parenting skills training, and psychotherapy, or even family therapy can all be beneficial in the treatment of ADHD. This will help children learn appropriate behaviors. Parent skills training can help parents learn about ADHD and how it impacts their child in order to better understand them. Finally, psychotherapy can be beneficial, especially if there is mental illness present when someone is living with ADHD. There are various misconceptions about ADHD which can be harmful. It's important to discuss and deconstruct these misconceptions as they give rise to stereotypes and stigmas and can harm people living with ADHD. As well, this can lead to a lack of understanding on what ADHD is and underdiagnosis. The first misconception we'll discuss is ADHD is not a real medical condition. Professionals acknowledge ADHD as a medical condition, and it can be hereditary. ADHD brain development also differs from someone living without the condition. People with ADHD need to try harder. This misconception harms as it can lower self-esteem of people living with ADHD. The lack of focusing or presence of symptoms is not the result of not trying, but because the brain is structured differently. The next misconception is people with ADHD never focus. While many people living with the condition will struggle with focus, there is actually something called hyperfocus. Many people with ADHD, when they find something they have interest in, may focus strongly on the activity. All people with ADHD are hyperactive. There is a stereotype that people with ADHD have tendencies to be hyperactive. However, there are various types of ADHD, one of which impacts attention. ADHD only impacts boys. This is untrue. A common occurrence is that this stereotype leads to the underdiagnosis of ADHD in girls. This stereotype derives from the fact that symptoms tend to differ between genders. The final misconception is people with ADHD will outgrow it. This can be very harmful, as people living with ADHD will not outgrow the condition. It's caused by differences in the brain. Therefore, it's best when individuals get treatment that works for them. Sometimes symptoms change as people get older or they learn how to manage them better. However, there are many cases where symptoms get worse or lead to adverse effects such as mental illness or substance abuse without treatment. There are many different techniques and ways to cope with ADHD in everyday life. As it can be challenging to handle many different responsibilities at once, it can be helpful to create a plan. You can do this by setting aside a time every day to think about the day and plan. Ensure you have everything you need for your comfort and day around you, and think about your values and goals, which can help with motivation. As there can also be difficulties with time management and procrastination, it can be beneficial to create lists, timers, and alarms. Timers and alarms can keep you on task and remind you of when you need to start something else. And by creating lists, it can give you a picture of your day, and if a task seems too overwhelming, it can be beneficial to break it up into smaller tasks. Finally, self-care. There are a few methods of self-care that we'll go over, the first being journaling. This can be helpful to get feelings out or discuss your day. Research has also shown that meditation can help people living with ADHD, as can deep breathing, as this can help self-regulation, especially in times of stress. It's also important to take care of your physical health, ensuring you eat enough and drink enough, and sleep enough as well, especially since people with ADHD often struggle around sleep, and adding exercise into a routine can all be ways to take care of your physical health. As it can be difficult to remember eating or drinking, it can be helpful to set up a timer or alarm as a reminder. And finally, reach out to someone. Talking to someone you trust about your experiences, or having someone who can remind you of your goals can be beneficial. It can also remind you that you're not alone. There are many ways to support someone living with ADHD, and we'll go over a few important methods. The first being positive feedback. This can be significant, especially as people with ADHD often have received a lot of negative feedback. As people with ADHD often have low self-esteem or higher levels of self-doubt, positive feedback can be beneficial to their own well-being and can be done throughout the day easily. Learn about ADHD. As people living with ADHD can often feel misunderstood, it can be beneficial to learn about the condition. Studies show that many parents of children with ADHD do not fully understand the condition or how it impacts their children. By learning about ADHD, it will help you understand their behaviors better and more about the condition. Communication. Communicating and listening can be important. Active listening and centering validation can be significant in supporting someone living with ADHD. Finally, it's important when supporting others to look after yourself as well. Establishing boundaries, reaching out for support from a loved one or a professional, and enjoying hobbies can all help you to take care of yourself. Supporting a client. There are many ways practitioners can support clients living with ADHD. Many people with ADHD are diagnosed as adults and can often struggle around a diagnosis, whether that be coping with a new diagnosis or avoiding one due to misconceptions. By reminding clients that it's a real condition and it's due to differences in the brain, it can encourage clients to learn about how they can manage their symptoms. Often people with ADHD will have problems with time management, which leads to many people not going to therapy appointments and receiving the treatment that will be beneficial. By having clients write down their appointment time and calling them in the morning as a reminder, it can be beneficial as they're more likely to remember and show up for their appointment. It also reinforces that you care about their treatment and well-being. Teach them about their strengths. As people with ADHD often have difficulty surrounding self-esteem and self-doubt, it can be helpful to remind them of their strengths. Validating their feelings around their experiences as well can be helpful. Assist them in understanding their behaviors. Many people with ADHD have difficulties in school, work, relationships, or engage in risky behaviors. Remind them that these are common experiences with ADHD, and if they continue with treatment, it will get better. Now we'll go over resources. The most important thing to take away from this video is that there are supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you would like to reach out for support. We will conclude our video with some important points to remember. ADHD is a neurodivergent condition. Individuals with ADHD have differences in their brain development and activity that commonly affects attention, the ability to sit still, and having self-control. While there is no certainty on the causes of ADHD, there are a few risk factors such as genetics, chemical imbalances, brain changes, the development of the condition during pregnancy, toxins, and brain injuries or disorders. There are symptoms grouped into 3 types, including inattentive, hyperactive, impulsive, and combined. Some individuals go into adulthood without ever knowing that they have ADHD, and every adult with ADHD has had it in childhood as well. To continue with some important points to remember, there are treatment options for ADHD, including medications and different types of therapy. Misconceptions surrounding ADHD can be harmful as they perpetuate harmful stereotypes and stigmas and can result in underdiagnosis. There are a variety of techniques and methods that can be used to cope with ADHD. Someone can support an individual living with ADHD in many ways, but it is critical to look after themselves as well. Practitioners can support clients living with ADHD in different ways to assist with time management or self-esteem. That concludes this presentation on ADHD. Thank you for watching.